Shalom.
Shalom. Hey, family.
Yeah, you probably like, what happened? Did they leave the country? No, we are still in Namibia and living life. It's tough, we're not by nature content creators. So it's very easy for us, especially when you're moving to a new country, you're trying to build your life and also living life to its fullest to just lose track of things. Good thing that you do a better job, I think.
Not on YouTube.
Yeah,
I post videos to TikTok because it's easy to just kind of go to a
that's true.
corner of the house and say some thoughts and then quickly edit it up. But YouTube it's a different place.
Different format. I feel like it
Yeah.
takes a little bit more. If, you got to set up and come out and actually prepare some content. So we wanted to first of all apologize for our absence. I think it's been a couple of months since we've been able to post, but a lot has happened. As you can see, we've been fruitful in the land, and that's a beautiful thing. And it was not something that I think you and I even thought not only possible, but wasn't what we were looking to do. It's just amazing how the Most High can lead your life in a different way. So now we have a new baby, and with that came a new experience, which is having a child, first of all, on the continent, but also the healthcare system. We had known the healthcare system from the perspective of checkups. Our kids go to pediatricians. We've gone to the dentist, things of that nature. I had a wonderful experience with the chiropractic care and with even I had like some things that I needed to take care of that just couldn't and didn't have the time in the United States to take care of. As you get older, you play a little bit of sports, you gain a little bit of knowledge. And surprisingly, when I came here, you would have never even thought this. I ran into a chiropractor, then connected me to a biokineticist here on the continent, and actually, I feel the best I have felt in the last 15 years, being able to just get consistent care. And one thing that's unique about the healthcare here in Namibia, especially private care, because I've heard some things about the public care that maybe there's some challenges, but we're not citizens, so our healthcare comes directly from we pay like a private hospital or private doctors, but that experience has been really well for us. It's done really well. But one of the things I like the most is that uh, the healthcare seems to be a lot more holistic in the sense that in the U.S. you have specialists, and those specialists know their stuff. You got an eyebrow specialist, you got an eyelid specialist, you've got a iris
Iris.
specialist, right? You've got an eye socket specialist, and everyone has a set amount of liability, set amount of insurance for malpractice, and they're going to advise you up to the insurance limits, and then they're going to refer you over to that specialist. And so sometimes when you're looking at when you're looking for healthcare that is um, sometimes when you're looking for healthcare that's holistic, it's hard to find. Well, I've struggled with it in the U.S. Like I just remember, you go to one specialist, they give you one thing, and then you'd hope that they could coordinate, but it just never feels holistic. It feels like you've got to go to each one for each one and pay your copay and get a referral. And I struggle with that. And with working full time and all of that, I just didn't have time for that. Uniquely, though, here, liability, for better or for worse, in this case for better, is not the primary driver of advice. And so you end up finding your practitioners, they have a more like holistic view on things, and that's been helpful for me to rehabilitate my body after all these years of sports and aging. And then we obviously went to a hospital, and we this is our third child. This experience is very different than the experiences before, and some cultural differences. Just to have a child on the African soil is restorative in a way that I'm just really happy that that is how it worked out. She's only breathed African air, and this is what she knows, and it's a great foundation, and it just feels very restorative. And if I was excited to have my kids on the continent, um, playing in the dirt, uh, then just imagine the joy of having a baby born in the continent. But obviously, the experience is really the most important. I know a lot of people wonder what's it like to even have healthcare in Namibia. What is it like to have a baby in another country? And Crystal, I mean, you can speak to it the most because obviously you did the thing.
Right. So having a baby in another country, I don't, I've only been to one hospital in the United States. And when I was there, I didn't have a good experience. So my experience foundation was negative. I know many women who have beautiful births in the States. And so it's not a state thing, but definitely my personal experience was that I had two kind of traumatic and very eventful births. And I didn't love the care. It was a hospital where the staff was a bit overworked. The hospital was cold. They don't give real medication when you have a C-section, even if you're not breastfeeding. And so there were just so many things that made the experience challenging for me. And I left each time just feeling really um, powerless, like somebody had taken my sense of control, and I didn't feel empowered by the experience of giving birth in the US. Coming here and having the experience at the hospital I utilized here in Namibia, and with the doctors that I had here, their way of approaching things is, um, I like how you said for better or for worse, but it's less technical. It feels less like I'm a patient and more like I'm somebody they are caring for. And it's a different feel. The nurses feel like aunties and cousins, and people have a different there's just a different way of treating the patient.
So when you go in to meet with the doctor before you have the babies, a lot of times, the doctor, at least in our experience, would come in toward the tail end. It's kind of like the last part of the show. Quickly look at the mother, give a couple of insights, and then they're out, and then you spend a lot of time with a nurse or kind of a medical assistant taking vitals, things of that nature. And it's very procedural. It's very professional. But here, we were with the doctor the whole time. So we would go in, we would meet with the doctor, then we would go into the office and do the ultrasounds with the doctor. And so the doctor was with us the whole time. We built a relationship with the doctor, and that was unique because I've never had a relationship with the doctor like this before. And so that was really unique. Where we, he every week we or whenever we would come in every month, every I think it got more frequent as we
It's
got
about
toward
6 weeks or something, every 6 weeks.
yeah every 6 weeks or whatever, and it was just intimate. So we're this is the doctor that's going to deliver the baby, and this is also the doctor who we see every 6 weeks. And at that point, you just build a quite a relationship, and it feels like they're invested. It doesn't feel so cold. It feels like we're in this together. He already knows. He's seen all. He does the ultrasounds. Not a nurse. He does the ultrasounds each time. So I appreciated that experience because it was unique.
Quick wardrobe change. So in essence, the experience was really good. I really enjoyed the hospital. The hospital was brand new. Things that were so different in the hospital were, one, the big bed they gave, they when you I had a C-section, and they take you back, you do your C-section, then you go to a room to heal, which was more medical in appearance. It had the normal small bed. The bed was
The chair
still,
was still very comfortable though.
The bed was way more comfortable than the one I had in the US at the
Yeah,
hospital that we had there.
yeah.
The bed there was
That
terrible.
military cot.
Yeah. So now we had good beds. Oh goodness. And then they after the first healing day. Okay. Then after the first healing day, I was after the first night of healing, we were taken to a big, really nice room with a big bed. And the intent of that big bed is to make it big enough so that you and your spouse can bed share with the baby.
Right.
So they gave us a very big bed in the longer stay room where I stayed 2 days so that you can bed share with the baby and the spouse. So they do expect bed sharing.
Yeah.
They do also really push, not in a pressureful way, but they expect breastfeeding as well. And so rather than it being an option, it's kind of the expectation. I went in knowing that here in Namibia, I see women breastfeed all the time, all over the place. And so I kind of felt like I would feel ashamed if I didn't figure out how to do this thing. And in my first time having a child, my son, I was very discouraged from the hospital experience and the I was traumatized. Like I said, I had a very tough time. It was an emergency induction. I wasn't ready. And then when I went and I said, I really want to breastfeed my child, they told me things like, oh, his sugar is too low. And I got scared. There were ladies that kept coming in the room and squeezing at me and saying, well, there's milk in there. And I was just very much turned off. And then I look
I
over,
think it was a cultural thing. I think it was a culture of the U.S. hospitals, or
well,
that hospital in
that hospital,
particular,
we were at that
that I think you're talking about, because the care was great. Our baby was born and healthy, but you know how you can
it was
yeah,
medically good,
we
but it
felt like
was,
patients as opposed to
yeah,
feeling like
emotionally
yeah,
bankrupt.
yeah.
So I felt overwhelmed and alone, and I didn't enjoy the experience. So when you're a mother and you're in that situation and you leave feeling powerless and you end up just giving up to the system and saying, okay, fine, just give him the milk. And there was not enough uplifting of my ability to feed my baby, and he was treated so medically. He was born just a couple, he was born a little early. They had this expectation that he was going to go to the NICU and all this stuff. He was fine. Um, but that was more so the focus. So with this child, my experience got to be one where the aunties, as I will call them, everybody calls each other sisters, so it's, sister so and so. And so the sisters in there, the aunties, some of them were my senior. They were able to teach me in a way that I could understand, and they helped me understand what was happening through the process, and helped me just feel like I had a partnership. I mean, granted, it is my third child now this time, but I do also just feel like they were very much more connected.
My perspective, just the first two were like she was saying, they were um, emergencies, so to speak. Things just kind of happened. Um, I think we're a lot healthier this birth as well, just because since we've come to Namibia, I think our diets have been better. Clearly, the stress load has reduced. It's cleaner air, y'all. Like for real, it's cleaner air, cleaner food. Um, we're at a different point in our life, so we're not in the hectic go go go, caffeined up all the time, just trying to meet the demands of life. Um, so I think we were healthier for sure, and so this one wasn't a surprise. It wasn't so that helped. So this was the first one that we could actually have the child and also prepare for it, know when we were going to have it, and just kind of ease into it as opposed to how they happened before. But the private hospitals here in Namibia, I just felt like the experience was really good. I felt comfortable. I felt like people were trying to take care of us And I'm really looking at her because you can imagine our two experiences before. She was a little distressed, so I can tell that as the father and the husband. So that kind of makes me feel uneasy about what's going on as well. She seemed much more comfortable, and that allowed me to feel comfortable when I had to leave to go see our other kids, make sure that everything's going okay at home, and coming back and forth. So overall, pleasant experience. One of the main things that people talk about when we talk to people about Namibia, or when we talk about coming to the continent, most people are scared of healthcare. They wonder if healthcare can be at the level of the states. Um, I can't say emergency care here because I haven't had an emergency, and I recognize that. When you have emergencies, that's when you want specialists. That's when so I haven't had emergencies. But as far as the healthcare, like the maintenance, checkups, going through the process of looking at things holistically, I think the healthcare is really good here in this country for sure, especially in Windhoek in the capital, especially with the private hospitals. I can't speak on the public hospitals. I know there's been some challenges here or there, but for the public hospitals, I know for certain because I've had experience with it. I find that I'm comfortable with the healthcare and have been able to actually benefit from it because there's things I've been able to do here that I just couldn't do in the states because I don't think the healthcare was holistic enough. I feel like it was a bunch of specialists and everyone could help you in their one spot, but the gaps. I mean, you have to know how to fill the gaps in between the practitioners, and I just didn't. I just felt like I didn't know how to do that. I didn't know how to do that. But here, it feels much more coordinated. So I can tell you, at least in Namibia and in Windhoek, the private hospitals are good, and the healthcare I think is the healthcare, the preventative care, the maintenance care is as best as I've had. But I can't speak necessarily on the sick care, the emergency care. We, knock on wood, hopefully, don't have anything like that.
Well, that's our latest update. If you are interested in, reconnecting with the diaspora, having an opportunity to connect with some people before you make a move to the African continent, you can join us in the diasporadevelopmenthub.com, where is our little community where we share information and we give you some upliftment if you're interested in this journey. People find each other and build relationships. We're having an event this next week. As we record this, our next meeting is on the topic of wealth. So we have different meetings and things of that nature. And it's a way to connect directly with us, ask us questions, and get involved. So hope to see you there. Are you thinking about investing in Africa but don't know where to start? Shofar Business Consultants is inviting you to our next African Diaspora Investment Tour, an unforgettable journey through Windhoek, Swakopmund, and Walvis Bay, Namibia. Meet real entrepreneurs, explore business opportunities, and attend a powerful conference packed with insight you won't get anywhere else. Don't just talk about Africa, come see it for yourself. Let's build something together.